The mission of the Department of Health is to prevent disease and to promote and protect the health and safety of all Rhode Islanders. At the Division of Community, Family Health and Equity, we strive to achieve health equity for all Rhode Islanders. We've come up with a new approach to public health. It's our health equity framework. It focuses on 4 pillars. 1, addressing the social and environmental determinants of health, using the life course approach across all programs, not just MCH programs, but includes chronic disease and environmental health. Focusing on leveraging of resources and partnerships to improve public health. And last but not least, in improving, we want to build the social and emotional competency of both our partners and our state employees.
We hope to develop programs and policies by looking at public health and health in general from a health and health policies approach. And what that really means is looking across sectors and looking at how all policies impact health. All of our agencies, whether it be our community partners, when they're making decisions, think about the health impact of these decisions as well. We've worked with community partners, in particular the Sankofa World Market, by working with them to address a specific community in Providence, Rhode Island, and looking at the cultural and diverse makeup of the community where 40% of the population is foreign-born, and looking at food access issues. And we really know that when immigrants and refugees do arrive to the United States, they are often healthier. And so Sankofa Market was born looking at creating a community farm where people can grow foods that are native to their culture, looking at addressing the housing needs of the community, creating a space where the community can get together, and looking at it as economic development opportunity for residents in the neighborhood as well to shop in their community, but also to be able to provide opportunities for business development.
Because we have this approach of health in all policies, we have the traditional partners in public health, community-based organizations, community health centers, but we also have non-traditional partners. We work with housing authorities, we work with faith-based organizations, with planners, with local government, schools, early childhood daycare centers. Everyone, in fact, who wants to work with us, we work with them.
Walking School Bus is a program that was started by Family Service of Rhode Island. It is funded by Safe Routes to School and the Rhode Island Department of Health. It was a program started to address chronic absenteeism within the Providence elementary schools. We have volunteers meet us at the school, and then we go on designated routes and pick up students that were signed up through the program that are deemed chronically absent or aren't eligible for school bus pickup because they live less than a mile, and then we walk them to and from school. After the first year of running the program, we tracked the students that were chronically absent within our program, and we saw a 79% improvement rate.
Our family visiting program brings evidence-based programs to support families and children to promote healthy development of babies and healthy outcomes of pregnancy.
The program has helped me keep sane throughout my pregnancy, just setting goals, and just how every time we have a visit, we have certain things that we say, oh, we're gonna do this, we're gonna do that. And I feel like that helped me during my pregnancy, just keep realizing that as a mom, I have things that I have to do that I should do to be a better mom.
The family visiting program are evidence-based programs. They have shown to lower rates of preterm birth, emergency room visits for pregnant women and children, as well as lower rates of child abuse and neglect. Rhode Island is working hard in all those areas.
The Dare to Dream initiative is based out of the Rhode Island Department of Health. We provide opportunities for students who have chronic conditions or special needs in order for them to be included in their community and to grow and to develop the skills that are necessary to engage in their school and in employment and to be a full member of society. We have over 900, almost 1,000 children that get together on an annual basis, that learn from each other, that grow from each other. We have every school district in Rhode Island participating in the Dare to Dream initiative.
It's a great place to be. You can talk about your story to other people, and it's a great place to learn about leadership and to grow your leadership and to grow to who you want to be.
It's a great experience. I think people should attend and they should be willing to speak and have their voices heard.
Focusing on the local outcomes of our communities, that's where we see the future for public health. We have what we call the health equity zones. It's our biggest investment in a place-based approach. We are investing more than $2 million in having community collaboratives come together using their own data to identify their strengths, their issues, but also the plans of actions they want to put in place, and we'll support the implementation of those plans of action.